यूट्यूब चैनल से हम आपसे मुखातिब हैं और आज भी हम MCPS, HCPS और PhD और दूसरे जो MBBS के और एलाइड कोर्सेज हैं उस सिलसिले में कम्युनिटी मेडिसिन और पब्लिक हेल्थ को रिकॉर्ड भी करते हैं, स्टूडेंट्स को बताते भी हैं। एंड today it is 19th December 2024 and the topic is iodine deficiency disease and commonly it is called IBDs, iodine deficiency disease. ID is also known as infectious disease. So these are overlapping. If it is ID means infectious disease, but if it is IBD, then it is iodine deficiency, which is non-infectious disease. It is basically a nutritional problem. So you can see that on the upper side, the throat will be swollen or deformed, or it will look larger, or it will be an abnormal look of the, and it affects particularly the human beings and girls, their beauty, their look, their adjustment in the social milieu. So it is also called beauty gland. Goiter is also called beauty gland because it affects your look. And from this picture, you can understand that it gives an unacceptable look to your personality, to your shape. Next. This slide gives you the definition. Iodine deficiency occurs when the body lacks sufficient iodine to produce thyroid hormone. So basic is thyroid hormone. So one can ask that why IBD occurs, because thyroid hormone, and that is thyroxine, we will come later on, essential for at least three things: growth, metabolism, and development. And here developments, cognitive development, mental development, or learning development. So it affects also the learning area. Next, please. And this shows that certain countries, and you can see that it is India and above is Pakistan. And this figure shows that 15 to 25% Pakistani people are suffering from iodine deficiency. And go back, please, the red area. And even India whole is suffering from more than Pakistan. So this is in many other African countries, but if you go up, then you can see the Western countries or the North, both are not suffering as compared to the South and poor countries. Next, please. Importance, these are T3 and T4, thyroid, thyroxine, and triiodothyronine, triiodothyronine, which regulates metabolism, growth, and development. Neurological development, adequate iodine intake during pregnancy is vital for the fetal brain and development, preventing intellectual disabilities and other neurodevelopmental disorders. Next, please. These are the few important causes of why it is. The most important is low dietary iodine intake, and particularly in the salt, the iodine is less. Vegetarian diet or vegan diet, pregnancy and breastfeeding, geographical location, more on the mountain area, the iodine deficiency is more as compared to the sea area. So if you are away from the sea, the goiter will be more. If you are near, suppose in Karachi, Badin, the coastal area of Balochistan, the goiter will be less, but if you go Punjab and upper country to Pomari and Ketu, then you will find that iodine deficiency is more. Thyroid disorders are very complicated, but they are non-communicable disease, so people don't think that if there is no pain, there is no fever, there is no urgency. So it is a neglected disease. And some of the medication we were just seeing from the Google that particularly rifampicin, which is used in the tuberculosis treatment, causes iodine deficiency and some other drugs. Next, please. Dietary deficiency is important. If soil is deficient in the iodine content, then the crop, vegetables, fruits, even milk will be less in iodine, so you will have this geographical locations far from the sea, lack of iodized salt, absence of iodized salt in the diet contributes significantly to iodine deficiency. Okay. Clinical manifestation: goiter, the swollen neck, hypothyroidism, in which you will feel lazy, sluggish, and some skin manifestation. Impaired cognitive function in children, iodine deficiency can result in reduced IQ. It can be less than 100. And impaired school performance. So if our students are failing or we are not competing with the world competition, one of the hidden reason or unknown reason is iodine. Cretinism, severe iodine during pregnancy can lead to congenital iodine deficiency syndrome characterized by intellectual disability, deafness, stunted growth,